Hi, and welcome to Wow Talk. I'm Donna Cappuccitti, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness.
Hello and welcome.
Hi there.
Based on what I've been seeing in the news lately, I am so curious to talk about hormone replacement therapy. And Dr. Gustin, I feel like you're the woman I want to talk to about this.
Sure.
Okay. All right. I'm going to bring it on. Well, to ask you the general question is, what's your take on it?
On taking hormones?
Yes.
Well, as a naturopath, for the vast majority of my career, I didn't have access to prescribing them anyway. Mm-hmm. So I had decades of experience helping people restore their body's ability to make their own hormones. Do you have the nutrients from which hormones are made? How is your adrenal and liver function as your ovaries retire, as you approach menopause? And my modalities worked. And then when bioidentical hormone therapy became allowed to be prescribed by naturopathic doctors, then I went and took the training and listened to what they had to say. And I'm grateful that we have that option of bioidentical hormones. So first there's traditional synthetic hormone replacement therapy, which is a pharmaceutical product only prescribed to patients by medical doctors. Mm-hmm. Then there's an in-between world of bioidentical hormone replacement therapy where the hormones are more natural, they're more identical to the way you would have made them yourself. And the reason the need for that came was because of the cancer risks that we discovered over time as people were taking synthetic hormone replacement therapy. And that cancer risk is little to nothing with the bioidentical hormone replacement. And so I took the courses and had the training, but never pursued to get the lessons to prescribe them because I didn't need to.
Okay.
Because I already had over 20 years of experience helping patients relieve their symptoms and improve their lifestyle and their nutrition and not have the hot flashes and the sleep disturbances.
Oh my goodness. So why don't we talk about some of the things that you have been prescribing then?
So the first thing to know is that hormones are made from fats. And a lot of people are over-consuming poor quality fats and under-consuming high-quality essential fatty acids. The most deficient healthy oil for North Americans would be the omega-3 fatty mm-hmm. acids. And basically that's the starting point. But okay. Sometimes there's all these other ways that people fall through the cracks, that maybe they're not good at digesting oils because their gallbladder was removed.
Oh my, yes.
Yeah. And then there's many other vitamins and minerals involved, like vitamin B6 and magnesium. So I look at all the nutritional things, and the key point that I focus on with my patients is that the most powerful hormone of them all. Do you want to take a guess? Which hormone would you think that would be?
You know what? We've talked about this before, and I have forgotten once again. I don't know. Just tell me.
It's not estrogen.
Okay.
Okay. So
and it's not progesterone either?
And it's not testosterone.
Oh my goodness. What is it?
Insulin.
Ah! Yes. Okay. Let's talk about that.
Yeah. So insulin is the most powerful hormone of them all. So you can do a lot with nutrition and stabilizing your blood sugar and consuming sufficient protein and having balanced meals, that when you smooth out your blood sugar, basically, a lot of hormonal things get smoothed out.
My goodness.
Even for a younger age with polycystic ovarian syndrome, the younger mm-hmm. girls who have cysts on their ovaries and miss their periods and have infertility and excess body hair, etc., mm-hmm. that condition in particular responds beautifully to a little bit extra protein. So there's sufficient protein, and then there's take a little extra. So I find that those ladies usually need a little extra. So I get the basics in first. I'm very focused on what we call lifestyle medicine.
Yes, you are.
And I don't want to talk about hormones or not even magnesium or B6 if we haven't talked about your sleep routine and your stress levels and your protein intake first. Like, always start with that.
Yes, yes. You've mentioned it time and again. We always seem to go back to that. It's such basic good living, right?
Exactly. And the other concern, really, there's so much more to the story. Is it really the hormones, or is it the endocrine disruptors in our environment? That so many of the toxins we're exposed to are hormonal in nature.
Oh my goodness. Okay, could you explain that in depth, please?
Well, if you Google the word endocrine disruptors, you'll find a whole new world of things. But general things like dryer sheets and scented candles and perfumes, basically anything with a scent is probably a hormone disruptor.
Oh my.
So if you think of just a typical young girl using hairspray, using their scented candle and makeup, and even the clothing that we wear, and the fire retardants, and you put gas in your car, you take a smell of that, and you have some coffee. Even caffeine is estrogenic. So if you sit there, if you look into it and you think, what did you do in a typical day? You've been exposed to a lot of estrogenic, hormone disrupting chemicals. So clean living is a big part of it as well.
Okay, so you're saying that those particular items like the perfume and the gas and the hairspray, it's interfering with the hormones? I'm kind of missing something. They're interfering with it, or are they depleting them? Like, what's going on?
They are chemicals that behave like bad quality estrogens.
Okay.
So they behave in an estrogenic type of way, most scented products.
Oh my goodness. So then would that not make it more of an overabundance of the estrogen? Like, I'm not getting it.
In a way, yes, that could lead to symptoms of estrogen dominance, but they're toxins that hurt us in a hormonal way.
Oh.
So even with estrogen positive breast cancer, which is a topic on its own.
Yes, and that's what I had, exactly. Anyway,
Right.
go on.
Yeah. So in my younger years, I found that when patients came in with that diagnosis and they wanted to test their hormones, and we went to the private labs to get the more thorough hormone testing,
Mm-hmm.
I expected, and so did the patient, that a person with that diagnosis would have elevated amount of estrogen.
Yes.
But that wasn't actually what I found.
Oh, what did you find?
What I found was that they had bad kinds of estrogen.
Oh.
So we make dozens of different variations of estrogens, and some of them are very protective of breast health, and some of them are very harmful to breast health.
Oh.
So I find that these toxins in our modern lifestyle are encouraging the production of harmful estrogens and having a direct toxicity effect as well.
Oh my goodness. Wow.
Mm-hmm.
Wow.
So it's not
think
as
of that.
simple as just jumping to the end and saying, I want HRT.
Well, that makes perfect sense. Okay, so let's say we're doing all the right things and we're eating well. We've got the essential fatty acids. What else would you recommend? Like, what are the other things that would help us as opposed to the HRT? Like, what would you add? Would you add?
My mind is racing going, okay, I'm gonna assume that the question is for a perimenopausal woman.
Okay, let's say that.
Okay. And so basically what happens is when we pass around age 35, our reproductive prime, we're passing our reproductive prime. Mm-hmm. And the ovary function starts to slow down. Mm-hmm. And as we approach menopause and there's fewer eggs left, the estrogen and hormone output of the ovaries declines with the egg count.
Okay.
And as we approach menopause, there's a greater demand for hormone production in our adrenal glands. Those are the stress glands. So in a younger age, the adrenal glands have a smaller contribution to the hormone production.
Okay.
And during and after menopause, they are the main location where the hormones are made.
Okay.
And basically what I just said was, it's all about stress management.
Oh, wow. Okay.
So,
wow.
Yeah.
Wow. Okay. So stress management, we've talked about it before, but we were going to do another episode on that, on just ways to manage the stress.
Mm-hmm. Because menopause is not a disease. It's not a condition.
No.
You're supposed to just stop menstruating and that's it.
Mm-hmm.
But the fact that you have symptoms, those are expressions of lacking the hormones. And the reason you're lacking the hormones is because Plan A, ovaries, are retiring, and Plan B, stress glands are stressed out, burned out, not doing such a great job at picking up the slack. So somebody's got to make the hormones. And if nobody's making the hormones, you're going to feel it. You're going to have your poor sleep and your hot flashes and your mood swings and your everything else.
That is so fascinating. Oh my gosh, it totally makes sense to me now. But I do have a question, and it pertains to me specifically and to any other woman who's gone through breast cancer right around the time that they would have been entering perimenopause or even menopause. What had happened with me was, as soon as I had my first chemo, I went into menopause. As soon as I had that first treatment. So I went from still menstruating. I was 50 years old. I wasn't even feeling the start of menopause, which maybe it was happening, maybe, who knows. All I know is I went from menstruation to menopause, like within a week. So my question is, like, boom, what happened there?
Well, it was a shock. Usually that is a transition. It doesn't happen over the course of 1 week. And chemos are very strong medications. Other drugs could do this as well. And the adrenals just weren't ready. Like the diagnosis itself is a shock. The toxicity of chemo, surgery, radiation, the emotional shock. So you can imagine that your stress glands, your adrenal glands, are not having a good week.
Yeah. And I don't know if they ever came back. I'm not sure. Exactly. But, we're looking at 11, 12 years later. And I was right into menopause. I don't remember anything else. I mean, I have felt, I feel a huge difference, of course, from before to now. However, I don't know. I don't remember hot flashes. I don't remember anything other than dealing with all the stuff I had to deal with the chemotherapy, which should be a whole other episode too. We could talk about and how to deal with that. But anyway, is there anything else we should cover before we say goodbye?
Well, I guess we were assuming that on this conversation about hormones, we were talking more about estrogen, testosterone, progesterone. There's also thyroid, which I want to definitely talk about thyroid at another time, because I'm seeing thyroid diagnosed, or what I call lazy thyroid, in 80% of my practice at this time.
Oh, gee.
And I refer to the thyroid as the vice president of the hormone system.
Okay.
And that thyroid hormone talks to every cell in the body. And a problem with a deficiency of thyroid hormone can look very similar to low progesterone. So if you think it's low progesterone, it could be thyroid, it could be both.
Okay. And can people get tests for these types of hormones through their medical doctor, or is this something that a naturopath does?
Both.
Oh, you can do both. Okay. Yeah. Okay. But I feel that it's not a routine test, though, is it? Or is it when we reach a certain age?
Thyroid?
Well, thyroid, no, but you can ask for that for sure. But what about the other hormones?
I think thyroid is usually on the list with an annual physical exam around here anyway. And I find that medical doctors don't test the hormones that often. And I don't blame them, because blood work's not really the best test anyway, but that's what our local government pays for. And then if they do give hormones, they tend to just prescribe them based on symptoms or age or both. And when they go see a naturopath, especially if they're falling through the cracks or have concerns about just taking the hormones, then I discuss the options and describe the difference of blood work, testing for hormones versus saliva versus the Dutch test, which is through urine, which is very thorough. That's where the road ends.
Oh, okay. Well, we should talk about all those tests again. I know we have talked about it, but we can do an updated episode. Anyway, well, thank you all very much for listening. If you have any questions whatsoever, please do not hesitate to write us and ask them and give us suggestions on what you would like to have us cover in the way of topics.
And we promise next time we'll talk about the guys, because it happens to you too.
Yes, it does.
Menopause, andropause.
Yes, it does. It does. And you can follow us on Instagram and on Facebook.
Thank you.
Thank you. And
bye.
Bye.